So let's open up our discussion. Today, we are talking about the impact of COVID-19 on Black immigrants, and not only talking about the impact, but we also are going to be talking about ways in which communities have been resilient and organized to provide COVID relief services. But I want to start with sort of the impact and what you all are seeing on the ground. Are related to how COVID has impacted individuals in terms of their livelihood. And Ade, I'm going to start with you because I know that you did an overall research around Black immigrants. And so I want you to give us sort of an overview, and then folks can definitely chime in and talk about sort of locally how that's showing up.
Yeah, great. Thanks, Chioma. So yeah, I earlier this year, just some personal background. My parents live in the U.S. and my mom works in healthcare, and she actually had COVID and it was pretty severe, but she ended up pulling through. And so my area of research is primarily in HIV, but with COVID, I sort of was interested in looking at a lot of the data that was coming out wasn't really sort of disaggregating like the Black population. And so I ended up doing a study that was trying to look at just the impact of COVID among Black immigrant populations, so both Caribbean and African. And so put together a survey, put it in the field, and we gathered data between January and February of this year. And since then, obviously, we know a lot of the focus has been around the vaccine. So initially, it was a lot of, who's getting tested, who isn't getting tested. But now the conversation is switched more towards vaccinations. And so for that particular data set, we asked questions both around testing and those who have had COVID or not had COVID. But then we also asked about if people were gotten vaccinated or not gotten vaccinated. For those who hadn't gotten vaccinated, we asked about their intentions to get vaccinated. And what we found was that around half of the sample said that they would get the vaccine as soon as it was available. Again, this was January and February. Now it's available to anyone who wants it. But we did see that also almost half of the sample said that they would delay getting the vaccine, which was sort of a cause of concern at the time. But we think now there's just more information out about the vaccine. And we hope that those who were waiting have sort of gotten it because they've waited enough time to sort of learn more about the vaccine. What we did find that was interesting was that we wanted to see who in particular is more likely to say that they would wait to get the vaccine. And we saw that women were more likely to say that they would delay getting a vaccine compared to men. And we also saw that individuals who worked in healthcare settings also were more likely to say that they would delay getting the vaccine. And so we have some thoughts around why that might be. We also saw that there was people who had previously had COVID also said that they would delay getting the vaccine, which there might be some ideas around immunity and antibodies and stuff like that. So I can talk more about what we found, but I think doing that study really helped us try to understand just the unique experiences of immigrants, because usually no one really disaggregates. And there was a question in the Q&A box about disaggregating data. If you don't ask people about, country of origin or country of birth or immigration, maybe not immigration status, but like immigration identity, it's hard to then really figure out who's in your sample. So that's all I'll say on that.
Thank you. I mean, I think you bring up, the question definitely prompted, but I think you bring up one of the biggest issues that, we're dealing with now as it relates to COVID-19, but health overall, being able to disaggregate the data. And what has been happening, I think, really is that the information about what's going on with Black immigrants has been happening coming from individuals and organizations that are doing the work on the ground, and not necessarily by, some state level or national level sort of database or information. And I think that is sort of very telling in terms of the resilience in the community, but also very telling in terms of the work that needs to be done. So you highlighted vaccines, and before we get to vaccines, I just want to hear from other panelists on sort of what did you see when COVID-19 first hit, and when it really became sort of a need to start doing some relief work. What were some of the challenges that folks were dealing with head on within their families and within their communities?
Um, can I chime in, Chairman?
Mhm.
Okay. Yes. Here in Maine, for example, first of all, I want to say that I am also part of an African Immigrant Health Research Consortium, and we have also studied some challenges faced by African immigrants during the COVID-19, and we have seen a lot of challenges that African immigrants face. But I'm just gonna give just few, and I know when we get to vaccine, and maybe I can talk more about the vaccine as well. So what we've seen at the beginning is maybe the information sharing, the guidance, the CDC, how people were receiving the guidance to guard against COVID, to minimize the spread of COVID. African immigrants speaking different languages were somewhat left out at the beginning of the pandemic because the information were not quickly translated in language that they could hear. So as a result, some of them were like out of the loop about all the precautions, all the, people were trying to get stock up, going to the supermarket to buy things to get stock up, to confine or to isolate. Some of the immigrants here in Maine, or refugees in particular, were surprised, for example, that why there were no toilet paper at the stores. So it's shocking when people go to the toilet, but they see aisles being emptied because they didn't get information as soon as possible. I remember being part of those that put the first information in different languages for African immigrants here in Maine. And we have also worked with some community collaborative, New Mainers Community Collaborative here in Maine, where we meet every week to design and educational material and information to spread the word out. So one challenge was language barriers and ability to understand the information that were being put out there about COVID-19. And other challenges were like, African immigrant communities lives in crowded area. And that was a very conducive area for COVID-19 to spread, for the virus to spread. So these are families of 7, of 8, and they are being asked to isolate, to spread out. And they are living in a public housing setting. So it was obvious that this community will be hardly impacted. Another challenge that I can think of is most of these African immigrant community members work in first line jobs, and that's where the virus was also spreading. So we were somewhat not surprised that the African immigrant community here in Maine were highly impacted by the COVID. So I will stop there, and I know some of my panelists and colleagues have a lot to say about this. Thank you.
Thank
Here
you.
in Pennsylvania, and I can speak predominantly for the greater Philadelphia area. And if you've never been to Pennsylvania, Philadelphia is arguably the largest county, or the second, 1, 2 largest county, and is very densely populated, generally speaking. It is an area where you have many immigrants, particularly from West Africa, Liberia, Sierra Leone, Guinea. That's where they come. And as they entered and resettled in Philadelphia, they then sort of, a few more years, after a few years, sort of dispersed to suburbia. One of the things that we saw at the early onset of COVID, really, in terms of its impact, was just this real shock. It was like a shock wave kind of, just came through, like a tornado just came in and literally just paralyzed everyone. And that the paralyzed that we saw, really paralysis that we saw, that is, came from many having experienced war, many having gone through Ebola. And the question being asked by many really was, I escaped war, I escaped Ebola, I came to a place that was supposed to be safe, and now I have met this. And so following that initial shock was just pure trauma, and shock and trauma all coming together. Just a lot of trauma triggering things: stress, anxiety, fears. Am I going to die? Is my loved one going to die? What is going to happen to me? And followed by just lack of information, as Insa said. There was very little information at the time to give a run. We were all, I think, throughout the United States, but we can speak for the greater Philadelphia area. We were all living in such a way as not knowing what was going to happen next. And it was extremely fearful. And I think for many, particularly our seniors, it was really trauma triggering, and communities, immigrant-led organizations, African immigrant-led organizations needed to respond quickly. And you know, the impact was such that the response was kind of slow before we started to pivot. You know, after we were all starting to wake up, okay, this is real, this is happening. Our people are dying, as Insa said. Many were in healthcare, in group homes. They're, you know, they're doing a lot of things that put them in the clear path of the COVID infection, and it was scary. And we saw, as part of that immediate impact, Africans were dying. I don't want to use the word like flies, but they were dying.
Mhm.
Immigrant-led funeral parlors were having so many funerals a day. You will go to an immigrant and African funeral, they generally will last a whole day. They will last in 30 minutes because we're just having as many barriers. A funeral goes so quickly, and the next group will be waiting outside, and then another funeral takes place, and the next group is waiting outside. It was a very challenging time. And for us, those were really some of the immediate impacts that we saw.
Yeah, I mean, I think that you bring up an interesting point, which we might not see in other communities, non-immigrant communities, is this re-traumatization, especially for African and I would say Caribbean communities who are coming over as fleeing, you know, war, fleeing trauma in their home countries, and this is just re-traumatizing them and causing some additional mental health issues.
Indeed.
Marie, I want you to step in. Did you see some of the same issues in the Haitian community? Were there other issues that started rising when COVID-19 first hit?
Je vais parler français. I can speak French.
Yes, go ahead. Insa will support you.
Okay, thank you. Dans la communauté haïtienne, durant la pandémie, on a eu beaucoup de difficultés, beaucoup de défis, parce que on a un défi qu'on a, c'est la langue, parce qu'on ne parle pas vraiment l'anglais. Et puis, quand on veut aller se faire vacciner, c'est un exemple, les personnes ont peur de se rendre à des sites parce qu'on va leur parler en anglais et elles ne comprennent pas vraiment l'anglais. I think l'anglais, la langue, c'est une barrière. Et puis l'autre barrière qu'on a, c'est ce qu'on appelle nos statuts. Le statut, parce qu'on a beaucoup d'Haïtiens qui sont en train d'immigrer. Ils viennent de Chili, du Brésil. Ça fait, lorsqu'ils viennent, ils ont peur parce qu'ils ont sur liste de déportation. Ils ont peur de se faire vacciner, même de se faire tester. Parce que j'ai vécu, on a eu une clinique mobile et il y avait des militaires qui étaient présents pour pouvoir vacciner les personnes. Les Haïtiens ne viennent pas. Ils ne viennent pas. On avait seulement 9 personnes qui ont pu venir pour se faire vacciner. Par contre, on a l'habitude d'avoir plus de 150, même 200 personnes. Mais cette fois-ci, le fait que les militaires étaient présents, la communauté pense qu'on va les déporter. Les Haïtiens ne viennent pas.
Marie-Jacques, je peux expliquer un peu ça, si ça devient trop long.
Yes. Oh, yes.
Okay. Marie-Jacques is saying that some of the challenges that the Asian community faced during the pandemic was language barriers. And there were a lot of language barriers because they speak only Creole and French, and everything was in English. And there were no translation for the Creole and the French. And also that in addition to the language barrier, their immigration status. The immigration status was also a factor into people hesitating to go do the test and also even get the vaccine. And she also gave an example, a very striking example, where she participated in a mobile vaccine pop-up site where at the beginning, people used to come to get vaccinated. You know, she gave an example of having 150 people vaccinated at some point. But when there were some military presence or some people, you know, uniform presence at the mobile site, vaccination site, they got only 9 people that showed up. So the Haitian community was afraid because of their immigration status, because some of them came through different countries. Some of them came through Brazil, Chile, and then they are afraid that they will be deported. So they don't, you know, show up. They became invisible because of their immigration status as well, and the fear of being deported. Yeah. Vous voulez continuer?
Okay. Yes, ce que je veux ajouter, c'est que le problème qu'on a, l'autre défi qu'on a, ce sont les tares associées, c'est-à-dire les maladies associées, parce que dans la communauté haïtienne, on a beaucoup d'hypertension artérielle, on a beaucoup de cas de diabète, de cancer, on a beaucoup d'anémie falciforme. Ces tares associées, on est devenu très vulnérable. Et puis, on a une communauté plus ou moins âgée. Tout ça, ce sont des facteurs de risque et qui nous ont permis d'être très vulnérables par rapport à la COVID-19. Et puis, la plupart des Haïtiens, surtout nous les femmes, on travaille dans la santé, HHS, CNA, LPN, AN, ce sont nous, les Haïtiens. On est à la première ligne. Pour cette raison, on a eu beaucoup de mortalité dans la communauté haïtienne due au COVID-19.
Yeah. Another thing Marie-Jacques wanted to point out is also other risk factors to COVID-19. In the Haitian community, they have a lot of people that have high blood pressure, cancer, diabetes, and anemia. So this has also contributed to the community being highly impacted by the COVID-19. And also most of their community members also are line workers, and they are also working in the hospital, they are nurses, and that also exposed them a lot during the pandemic. So these are some of the challenges you wanted to talk about.
Thank you.
I want to add something quickly from what Kamara said, Portia said about, you know, the religious, the funeral activities during the pandemic. I would also stress on that. That was also something that it really, that was a challenge in the African immigrant community. In many African immigrant community, you know, they have a lot of those religious practice that they usually do. They have to get together. During the Ramadan, for example, the Muslim community was highly impacted. And when there were deaths, you know, sometimes people have a way of doing their funerals. Sometimes it lasts through days. Sometimes people gather in the deceased family's house, home. All that were not happening, and it has had a lot of some impact on people's mental health, etc.
Thank you. I mean, I think, you know, Marie brought up a very good point around immigration status. And I have to say, often people associate that with, oh, individuals who are undocumented. But what we saw in Massachusetts, and I think what's happening nationally, is that it was all immigration status. Individuals who were documented, you know, had DACA, had TPS, were naturalized. There was just fear. And fear of going to receive services. In Massachusetts, we've had some raids and ICE picking up people in places that are supposed to be safe havens. And so it's not just about undocumented individuals. It's about all immigrants having this sense of fear given the previous administration, but also just because of seeing presence around police and law enforcement that prevents them from wanting to get services. And this is with COVID. We saw this with COVID-19 testing. And like Marie said, we're also seeing this around vaccination at vaccination sites. So Ms. Portia, I want to pivot the conversation a little bit. Ms. Portia, brought up the impact that it was having on organizations doing the work. And I know two of you all work at grassroots organizations. And so I wanted I wanted you to share a little bit about what this meant in terms of the work that you're doing, and how it caused you to sort of shift, but also overall might have had an impact on just you being able to do the work, giving, for us, we had to shut down for a month. Clients were still in need. It didn't matter. And so us really having to quickly rethink how we were going to serve our communities.
Interesting. Here at the Multicultural Community Family Services, as I shared, initially we were all shocked. Our organization is, the front office is predominantly comprised predominantly of Africans with work, and we were dealing with our own trauma, having escaped war, having escaped Ebola, just as our community was dealing with the same thing. We knew, however, that because we were a grassroots organization, as many others, it was not we could not take the approach or response to, hey, let's shut down, even though we wanted to, we just couldn't. A part of that also was because in addition to being a community-based organization, we are also a licensed home care agency. So we became a mandated, an essential organization, and we couldn't close our doors. We were serving seniors. We were serving a vulnerable population, we all do, that needed us. And as things shut down all around us, we knew that we had to pivot and take on a strategy of, if they cannot come to us, we are going to go to them. And that going to them meant also internally looking at what structures we had and where capacities needed to be built or needed to be strengthened. If we're going to them, what were we taking to them? Were we taking food resources? Were we supporting their healthcare needs, be it medication or home care workers? What did we need to do in order to ensure ourselves first? Ensure safety for ourselves and provide their needs. So part of that strategy in terms of going to them was to identify our own needs. As I said, we needed to get PPE for ourselves and our home care workers. And at the time, there weren't any, right? You could not find any kind of PPE in the store, protective personal equipment in the store. So we started to make some of our own. We bought the alcohol, and we bought, looking for 70%, and we went to the store and bought all the different gel products, aloe vera, and we started to make our own hand sanitizers because there weren't any. We went to the stores and bought every plastic tablecloth we could find to make coverings for our home care workers to ensure their safety. We did, Clorox and mix it with whatever combinations there were, and to get disinfectant for our staff. But we also, in the process of that, had started serving seniors many years ago with just once a month food boxes, and we found ourselves immediately pivoting to becoming a food pantry and reaching out to the community and getting much needed food, not just any foods, but cultural appropriate foods that our people needed. And we started to deliver them house to house, from rice and oil and all of those things. One of the strategies we did in terms of our response was also to establish a conference calling line for our seniors, because we were meeting with them every week, twice a week here on site at our center, and we couldn't meet with them anymore. But we knew the significance of staying in touch because of their traumatized history. And so we started to meet with them twice a week over the telephone. And for the first time, they were able to learn how to do conference calling and dial in. So those were some of the ways that at Multicultural we pivoted. But I think most importantly, as we looked around and found that We, as one organization, were just as underfunded as many others. As you all know, many grassroots organizations are underfunded. We knew we could not do it alone. And so we started to reach out to other immigrant-led, African, immigrant-led in general, for African specifically organizations in the area, and say, hey, we need a more collective, collaborative response. Can we come together? And through that work really came not just the convening of immigrant-led organizations, but a coalition known now as the Delaware County Immigrant Coalition, comprising of many African-led nonprofits, small nonprofits serving their people from within the Haitian community to the Kenya community, the Sierra Leonean community, Ethiopian community, the Liberian and the Nigerian community. And we are very excited and pleased to share that that coalition continues to be strengthened. We gave birth on April 10th of 2020, and today has really become the go-to one-stop for services for immigrants in this area. And a lot of the immigrants served, of course, are African immigrants. So through that work and that pivot, knowing that we could no longer work in silos, because what we found at its onset, that all immigrant-led organizations, African in particular, were working in silos, everybody attempting to do their own thing. And we were struggling, and we knew we had to change that and shift. And it has been really, really awesome being able to do so and have those kinds of collaborations and partners now in the field.
Thank you. I mean, it's good to, you know, part of the work is realizing sort of what are some good things that have come out of this, right? And we've seen the same thing in Massachusetts, where we have built immigrant-led coalitions that are stronger because we've been able to see that commonality around what does it mean to be immigrant and doing this work and the impact is happening on our communities. And given that immigrants, you know, don't have the same sort of advocacy, some of the same sort of big numbers in certain cities, us coming together makes us, you know, be able to set a stronger case. So that collective organizing work, I think has been a plus in coming out of, you know, this sort of very traumatic experience across our communities. Marie, can you share a little bit about how your organization has supported Haitian families and communities through this pandemic?
Durant la COVID-19, on a assisté la communauté haïtienne avec soit des nourritures crues, food pantry, on leur donne aussi, we give them gift card, we give them the cash assistance. And we tried, we helped them to find a house because, comme mon capitaine du moins là, je peux parler français, parce que on a eu beaucoup de familles qui n'ont pas pu payer leur loyer. Pour cela, on a fait des demandes, on a eu des fonds disponibles et on a assisté beaucoup de familles. Et on a, durant la COVID-19, on a eu des cours de musique pour les enfants, on a eu des cours de danse virtuels pour pouvoir les aider à traverser, à passer ce moment qui était très, très, très difficile.
I think she tried to say some in English, but a few ones that are said in was like, they try to assist the Haitian community with food because of maybe, I imagine, isolation, and they have to give food to people that are in isolations. And also, there are some family that were unable to pay for their rent, so they assisted. They give some rental assistance to those families, and also they have to entertain the kids through some virtual classes, dance classes or music classes virtually to to assist them. Yeah.
Thank you. And I'm gonna put you on the spot a little bit, because I sort of sit in the middle of. I always tell people I have one foot in academia, maybe even just my pinky toe in academia. And so all this is happening, right, in the community. And academics are responding, right? They're wanting to sort of, figure out sort of the nuances of what's happening in community. Did you find that it was challenging to get your research going? Because Black immigrants might not be in the forefront of people's minds as it relates to doing health research. I just want to get a sense of sort of maybe if you had challenges on even trying to start figuring out what's going on in communities with your research.
I think for me, because I hadn't worked with immigrant populations in the past, I think personally it was a bit harder to just. I had to, if you're an academic that does truly community-based participatory research, you sort of have built relationships with community-based organizations and you have partners. And for me, I didn't have those relationships. So in doing this study, what made me want to do the study was not really seeing any data that was disaggregating African immigrants, which then made me think, well, isn't nobody thinking about sort of this subgroup, which kind of answers your question. So for me, I then was like, well, let me try to see what I can do, sort of knowing that I have research skills and just really trying to think of ways that I can contribute to the conversation and gather data, which is evidence, which hopefully will drive, policy or just drive action in the COVID and trying to get COVID sort of under control, especially in African immigrant communities. And I think then looking through the literature, there really wasn't anything that sort of was specifically looking at African immigrant populations or Black immigrant populations at all in the US, which wasn't surprising. And so I guess for me, it was more so trying to find organizations and find people to partner with. But then I think people were attuned to the racial disparities that exists with COVID, but more on the sort of Black versus white or Hispanic versus white, Asian Pacific Islander versus white, not necessarily then the sub level of like, well, what is Black? So I don't know if that answers the question, but.
Absolutely. I mean, I think that you're bringing up sort of, what does it mean for us to not only think about organizing work, as Ms. Portia and Marie were talking about, but also thinking about how do we place the issues of Black immigrants up front around research. And you brought up community-based participatory research, which is really focused on research that can be applied for action, because we need both. It's not an either or, we need both. So Enza, I want to sort of lean in your direction, because you sit at the state level doing refugee services. So what were some of the ways in which your office really started to respond, knowing what was happening with the refugee communities in Maine?
Yeah, we actually, I would say in Maine, it was interesting that when this thing hit, as early as May 13, I think May 13 was the shutdown, or May 12 was the shutdown here in the United States. And as early as May 13, here in Maine, we have, there's an organization, a collaborative here called the New Mainer Community Collaborative that got together as soon as possible and have seen what could be the devastating impact of this pandemic on the immigrant population, and have started working already in educating and in mobilizing PPEs from donors and then distributing them to their communities, to churches, to immigrant-led organizations. And I would say that in Maine, this community collaborative of ECBOs, a lot of ECBOs, have started even doing the work on the ground before the state could join, because there was some structural barrier with the state, which has the means to do this way, which are the finances and the means, but how to get it down to the people was sort of a problem. There were a lot of logistic issues there. So what we did, we advocated sort of, through that community collaborative of ECBOs in Maine, to get the state to establish what they call social services for isolation and quarantine that was led by the DHS, where all these ethnic community-based organizations were members, and where they can bring, their need on the table for the need for the community on the table, and DHS were having a way of financing them. But even though to get the finances to this ethnic community organization group to do the work on the ground was, I think they have discovered that it was very difficult, because there were some requirement in place that this small organization could not meet. For example, there's a reporting requirement that this small organization could not meet. There are some capacity level the state want that this organization don't have, but they recognize that this ethnic community-based organization were very effective on the ground to do the work. Even as simple as contact tracing, for example, I'll take that one example. There are a lot of challenges in providing the service, but as simple as contact tracing service that the state epidemiologists were doing, they were having problem doing that with the immigrant population because of language barrier, because of culturally and linguistically inappropriate way of communication. Your phone ring from a 1-800 number. As an immigrant, you are like, maybe somebody's after you, you will not pick the phone, and but you don't know that maybe this is the state epidemiologist that is following up for your positive test or your negative test, for example. So these ethnic community-based organizations here may have to come in between to help do that, okay? And also, social service for organizations was established, and also they the community collaborative, the New MENA community collaborative also was very good. Even up to now, they are still very good at meeting weekly to discuss about culturally and linguistically appropriate messaging and education for immigrant communities. I mean, from my own office, because, again, the status will come in, because I work with refugees and asylees, I work with some status, distinction of the immigrant population. We were able to create like a team, a core team from all the people that we work with, from the Office of Refugee Services and also the resettlement providers. We created a core team that was collecting data on all the immigrants that fell in our categorization and that have been impacted, and then we were providing all the support we think we should provide to them. We were meeting them virtually. Sometime at some point we were able to even find a technological device and give to them so that we can communicate with them, like tablet or computer sometime, to be able to communicate with them while they are impacted by COVID. So I can say that in general, it has not been easy. It has not been easy, even when the state has a means, even when the federal government gave all this money to all the states, but to put that means in action with this particular population could not be done without ethnic community-based organization, and also without community health workers. They were very, very, very instrumental in helping the community. African immigrant communities in particular.
Definitely. Go ahead.
Yeah, here in Pennsylvania, and it's so great hearing what Inside is saying about the state of Maine and its response to this pandemic. In our area, Greater Philadelphia area, Pennsylvania, was sort of different. I think the greatest response came in terms of support, funding support came from the philanthropic world, where they just opened the doors and they gave, and they were willing to give to all organizations, even if through an intermediary, if they did not have the capacity to receive those funds themselves. And I think this is where the benefit of coalition building really came into place, because within a coalition you have the strongs and the not so, and for each brand opportunity that came the way of the Delaware County Immigrant Coalition, for which Multicultural was its convener, you would have one organization taking the lead and becoming the fiscal sponsor, and then being able to disperse those funds to other organizations. And when another opportunity came, another organization with the capacity took the lead. So it really was a beautiful thing to see shared responsibility and leadership being taken on that way. And having those organizations serving as an umbrella for smaller ones who did not have the capacity to have applied for those funding opportunities, but yet were equipped through the coalition to be able to receive needed funding to serve their people.
Yeah, I mean, we had the same experience, you know, in Massachusetts. And I think, you know, one thing I can say is that foundations really stepped up to support immigrant communities. And then there was also a particular immigrant collaborative called the Massachusetts Redistribution Fund that I think did something very innovative, in which they created a fund that allowed people to, if they could afford, donate their stimulus money, right? Because we know members of immigrant communities, some did not have access to stimulus money, right? And so they were able to collect a significant amount of money and distribute it amongst immigrant organizations to give out to immigrant communities. And so I think there are some innovative ways in which folks are thinking about and doing, not just thinking about, but doing, funding the work that needs to be done. But definitely in Boston, you know, the foundations really stepped up, because there's so much restriction, like you said, there can be so much restrictions in getting money from the state or even from, you know, federal resources, and it doesn't allow us to adequately serve. You know, Marie brought up, you know, the point of being able to give out cash assistance, right? There was only certain funding that allowed you to give out cash assistance, because we have to trust that people know how to spend money, right? They know what they need and they know how to purchase and go about, you know, using that money, right? And that we don't have to dictate that. So, you know, definitely kudos to what's happening in your states around sort of allowing for that innovation and that that creative way of serving our communities. Marie, I don't know if you want to say something. You look like you want to say something.
À propos des stimulus, des fonds disponibles, Inza.
Oui.
OK.
Non, elle a demandé si tu voulais ajouter quelque chose à ce que tu as dit avant.
À propos de ce qu'on a donné. Oui, normalement, yes, normalement, on a donné des cash assistants à la communauté haïtienne, bien que ça n'a pas été suffisant, parce que la communauté est tellement vulnérable, on n'a pas pu, et puis nous, la communauté haïtienne, on a low income, OK, mais on a quand même essayé de les aider, de les assister durant la pandémie. On a eu accord à d'autres organisations dans la communauté haïtienne, telles que Immigrant Family Services Institute, HAU, pour pouvoir collecter des fonds pour aider à la communauté de traverser la pandémie qui était si difficile pour eux.
Okay. Yes. We did some cash assistance, even though it wasn't sufficient, and the community was very vulnerable, as she said earlier, and we have to also call on other organizations, you know, to fundraise and to be able to assist the community with some cash.
Thank you. So there's been a couple of questions around data, and I want to sort of for us to touch around that. There's been a couple of questions around how do we suggest or recommend people to start thinking about disaggregating data, and then, you know, how do we think about that in terms of looking at what's happening in the community around different issues. And one person brought up around access to and utilization of vaccinations. So, you know, Ade, to give people something very, very practical, can you share in your survey, what were the variables you used to disaggregate the Black/African-American racial category for your immigrant study?
So so in the recruitment, we really targeted Black immigrants. And so we didn't have to, initially we were going to do a survey where it was sort of Black people in the US, but then I felt strongly about it just being specifically for Black immigrants, just because there's data comparing different racial categories that I would guess would include, actually, or maybe not include Black immigrants as part of the Black category. And so this one just sort of, to be in the study, you had to be first or second generation Black immigrant. So if you weren't, then you weren't eligible. I will say, I mean, the way we asked, I think it comes down to if it's even a question that comes to mind to ask in the first place. So if you're not thinking about racial categories and sort of how that intersects with immigration status or immigration identity rather than status, because documentation status actually might dissuade people from disclosing whether or not they are an immigrant or children of immigrants. But I think if you're not asking the question, or if you're not thinking about that even being a question to include in a survey, then that's sort of, there's not really a conversation to be had. So I think it's more so around including questions that will sort of get at, because if the assumption is your data is you're collecting data from sort of US born populations or non-immigrant populations, then that's not really the approach that I would take. I think having, even if it's one or two questions that sort of try to get at immigration identity, I think that's the best way to go. And we don't have that right now because the data we see on a national level only has Black as a catch-all category.
And if you could just maybe for folks who don't know, explain first and second generation and why you felt it was important to include second generation as part of your study.
Yeah, so how I define, and everybody defines it differently. So first generation would be people who were born outside of the US. Some people might call that immigrant. So if you were born out of the US, we define you as first generation. Second generation would be if you had a parent that was born out of the US and you were born in the US, at least one parent that was born out of the US. Some people would call that first generation, but it depends on the field and who you're talking to. So to be in the survey that I did, you either had to have been born out of the US or had a parent that was born out of the US in an African or a Caribbean country. And so that really sort of, we did have some people who identified as African American, but it was maybe 2 or 3 people out of 300 in the survey.
Go ahead.
Yeah, about data, I think I totally agree that this is very problematic because here in Maine also, when the pandemic started, at some point, we wanted the CDC to disaggregate the data because we wanted to know how many of our community members are being impacted, because we believe that we're being disproportionately impacted because of the way we live in crowded area, the way we don't have the means to socially distance safely, economically. So we wanted the CDC to give us some aggregation of the data, and it was a battle. They could not, and they didn't want also saying that they may be exposing some group of people because maybe there may be some backlash on the immigrant brought the COVID. So, and listening to Ade, I think it's like disaggregation of data among Black and immigrant. It's like, unless you are doing a purposeful sampling and you are doing your research is purposely targeting a group, and then you go there and then get your data, it's going to be really tough because this is it's like a structural and policy problem nationwide to do this, and the discussion is coming all over the place. For example, I attended a webinar where there was a public health professional that was saying that, for example, and I think I saw that in the chat too, somebody was saying that not all Black or not all immigrants are refusing the vaccine, for example, or are hesitant for the vaccine. And this research, this public health professional was saying that Blacks or immigrants are being, wrongfully accused of vaccine hesitancy. But she believed that if people get the right information, they are likely as anybody else to get the vaccine. So the problem was, getting the right information and getting also the right demographic, the right data or the right information about who you are and who is Black and who is immigrant and who's even within the Black immigrant community. There are, nationalities, there are ethnicities, so it's a very complex situation. I totally agree that it's difficult to do that, but if we want to, anybody or any organization that want to disaggregate such data, unless they are doing some purposeful sampling or they are doing their research, is really targeting a particular group, and they go where they can find those groups. Maybe they'll be likely to get their data appropriately than, trying to disaggregate as in the system, in the current system. Yeah.
I wanted to add, very well said, that I think it's important to note that African immigrants and Haitian immigrants were not just disproportionately impacted because of or where they live or crowdedness in some communities, right? But we know within the immigrant community, or we know just generally speaking, that immigrants across the spectrum, from academia to everything else, we are working predominantly within the human services field, right? We are in healthcare settings, we are in schools, we are in restaurants, we are in factories, we are in residential facilities. We are in contact with the public at so many different levels, and that made us very vulnerable to COVID and being affected by COVID. And many of the deaths that occurred within the African immigrant community was as a result of that. Yeah, overcrowdedness, indeed. That was just one variable. There were, we believe we're on this side, that just as equally in terms of perhaps the most impactful variable was the settings that many African immigrants work and how they were impacted or affected as a result of that.
Thank you. I want to spend a little bit time before we get off and talking about vaccinations. And I think you brought it up as part of, in the beginning, and so you just transition us into the conversation. But, what has been some of the myths or misinformation that you're hearing about vaccinations within your community? And based on those myths and misinformations, how are you addressing them and providing correct information? So what are some of the myths first and misinformation that you're hearing?
Je peux commencer avec une start?
Oui. She wants to start.
Yes. On a beaucoup de mésinterprétations de la vaccination. Parce que les Haïtiens pensent que on a inventé le vaccin, c'est pour tuer la communauté de couleur. C'est si je me fais vacciner, je vais mourir. On a eu la vaccination, c'est pour diminuer la quantité de la communauté noire. Et on a beaucoup de mésinterprétations, de mésinformations du vaccin. Normalement, dans la communauté, on n'a pas vraiment de problème avec la vaccination, mais on a problème avec le COVID-vaccine. Ce n'est pas les vaccins généraux, mais c'est le COVID-vaccine. the Haitian community don't want to take the COVID vaccine because they think the COVID vaccine was created to kill them.
Okay. Yeah. I think you heard it. She summarized it. She said, she said, you know, there are a lot of misinterpretation in their community about the vaccine because the people in their community believe that the vaccine was created to kill the Black people, and they don't want to take the vaccine. And she also added something that's very interesting, that people in her community are not afraid of vaccine. You know, they are not afraid of vaccine in general. They can take other vaccine, but they are afraid of the COVID-19 vaccine because of the misinterpretation behind it. And I would just take on that point to say that, yes, I think people are being Black in general, or African-American, African-American, Black, African immigrant in general are being probably labeled wrongly about vaccine hesitation. I think what we need to look for is, where are people getting their information about the vaccine? What information should we be giving to people about the vaccine? Because people are not saying that I will never take the vaccine. I have two instances where I am part of an African immigrant group, you know, from the Ivory Coast, and another group from other countries, where people are posting YouTube videos about seemingly true statements from people that look quite like, you know, they know what they are talking about, that they have data to back up what they are talking about, saying that the vaccine contains GPS. If you take the vaccine, you're gonna be tracked all the time. You're gonna die if you take the vaccine. And these are the information these people have. And the state or the CDC, I know they are doing what they can to create to counter those myths. But I don't think they are doing a good job to reach, you know, this particular group. And another thing also people need to know is, this group get their information most likely from the home country where they're coming from. And what is happening there, the CDC here has no control over that. So that makes it difficult to take them out of that bubble and give them the right information so that they can have the right attitude towards the vaccine. That's what I see. And I think having like some innovative approach to informing this community about what the vaccine is probably will help, you know, again. And again, I don't think they don't want to take the vaccine. They might be hesitant because of maybe what they have been hearing from a YouTube video from their home country. But some of them also feel like they want to wait before they can take it. And some of them feel like, if X, Y, and Z take it, I will take it. There are also those statements in the community. And some of them would say, I heard some making fun, like that's one of my friends, when I took my 2 doses, he said, okay, if I don't die in 2 years, he will take the vaccine. So, so there's, you know, a statement like that we hear. So I think the public health system need to do a better job, you know, in fighting those myths and helping the community stay safe.
When we started going beyond testing, you know, encouraging people to get tested, once we pivoted to vaccine, one of the things that we saw and we were not prepared for, because as we started horticulture as its own entity and working in collaboration with the DCIC, Delaware County Immigrant Coalition, as we started to you know, secure funding, one of the things that we were presenting or incorporating in our proposal was there wasn't a problem with access, and we needed funds to help support access. And we also said, based on what we thought we were saying, that there was hesitancy from the get-go, and that hesitancy was based on the lack of trust in government, right? Where is this vaccine coming from? Yes, it's coming from pharma, but who is supporting pharma, and what is the intent behind getting these vaccines off the ground? And these vaccines are being developed so quickly. What is behind that? Historically, we go back to experiments that have occurred right here in this country. We can think about the Tuskegee experiment. That is not lost on on Africans at all, not lost on even people from the Caribbean. So you go back historically and you see what is there, and it's like, no, because this could really be an experiment. We do not want to be guinea pigs. You go back to some African countries, even right now, including Liberia, where there are, acreage of labs that are set up by Western companies, and they are conducting experiments. That does not promote safety. So when you have that kind of historical baggage, and then the government is attempting to communicate that the vaccine is safe, who's really going to listen? We know that the most powerful medium of communication we have in the African community is word of mouth. And all you need is one person to begin to share that misinformation. And for many, to them, it's not misinformation. This is scientific and this is information, because that's how they're receiving it. And so you go from, you see all of that happening, and you see other people begin to take the vaccine, and then some of the side effects begin to, come about, where people are being impacted badly, severely. And so we started with, we think this is going to be a lack of trust, and where we do not think people need, we get this, we really need to do a push and need to do the education and provide the information, the outreach. And initially, there was really a very strong positive response to taking the vaccine. And, people really wanted to take the vaccine. And then some side effects started to happen, and Johnson & Johnson came about, and hesitance just went through the roof. And now the response by members of our community is, no, my husband took it and his neck got big like this, and now I don't want to do it. So for them, there is a rationale behind why it's not that, as you said, they do not want to take it, but why they're hesitant. So you see a lot of, more of a wait and see approach, right? Let's see what happens. Maybe if it goes well, then maybe I can. So as you say, it's not that they do not want to take it, because our data does not support that. There was really a willingness by people to do it, but that because of some of the things that are happening, included as the history that I talk about, people are really starting to hold back.
Thank you. And, I want to point out, I want to directly point out that even though the use of vaccine hesitancy is problematic because it puts it on the individual, but like you all are talking about, it's so much more complex than that. It has to do with people's history with this country, right? We can talk about the history of Haitian immigrants coming to this country and how they were traumatized through the HIV era, right? And isolated and blamed for HIV, and how that ends up being an impact now in terms of how the community engages. We can definitely, Ms. Portia, like you brought up, even talk about what's happening in people's home countries and how that impacts. So there's history there. There's challenges around the structure, like Enzo was saying, in terms of, we know that there's the right information out there, but it's not the medium for communication, lacks cultural and linguistic appropriate ways, right? And so we have to think about sort of those surrounding cultural or social factors that make it challenging for people to want to get the vaccination. I want to talk a little bit about, before we have about 10 more minutes, I want to just ask you all, a broad question. What do you think recovery will look like for Black immigrants? Right now, places are opening, states are opening, states are saying you no longer have to wear masks, right? that fears me in a way, because I know what's happening in our communities, and our communities are still, Black immigrant communities are still dying of COVID-19. I know certain places in Massachusetts where there are a huge number of Black immigrants, such as Mattapan, where there's a huge number of Haitian immigrants. People are not having access to vaccinations. And so this idea of recovery is a little concerning for me. But when you think about recovery for Black immigrants, COVID-19, recovery for Black immigrants, what does that look like, and what needs to be put in place, do you think?
What I can say, I will probably look at a little bit of some international perspectives, because when COVID hit, mobility was reduced, and immigration was drastically reduced, and Black African immigrant maybe might have been impacted economically. So poverty might have been increased in those communities and those population. So I see that maybe recovery will mean that maybe every activity, maybe economic activity will be starting, and mobility will resume, and people will be able to move about and do their work, and then probably improve their economies. And also what I see is maybe recovery will mean that we've learned our lesson. Everybody would have learned their lesson, especially at the state and government level. Maybe we are seeing a lot of equity and inclusions, discussion going on in a lot of structure and organization across the nation. And I think COVID recovery will mean, if those discussions are sincere and well designed, will mean some improvement in equity and access for African immigrants. And again, what you said, Choma, is true. Some people, there are a lot of forces at play here, but I believe that, by the time we hit herd immunity, I think that's what they call it. By the time, 80% or 85% of the population is vaccinated, recovery will mean like, maybe COVID will be just like the flu vaccine that everybody have to take every year to kind of get by. I'm being positive here. I'm being really hopeful here. Yeah.
I think for me, considering what we experience in our community, the lack of access, lack of resources. So even when resources were made available, access to those resources were not available. Recovery for me would mean that the level of disparities that existed within these communities would have been significantly reduced. It would mean that the African community does not, become the last community to be identified as a community of need. It would mean that recovery becomes one where we stop identifying as, let's look for these underserved communities or these immigrant communities. Recovery means changing the conversation and empowering our communities to advocate and gain greater access to resources. In the Philadelphia community, Philadelphia Upper Darby community in Pennsylvania, we were able to get much and yet very little because of our advocacy, and we had to fight for it. I hope we don't have to do that when the next pandemic comes. We hope it never comes, but when the next crisis erupts. Recovery means saying less Africans and immigrants, period, standing on the food line, something that in our community we never did before. One of the things we pride ourselves on was working hard, earning, and then taking care of ourselves. And here at the Calabash Pantry where we serve, I cannot tell you every given week how many African immigrants are lining up to receive food because they are either unemployed or underemployed. Recovery for me will look like having the mental health resources that would be available to support individuals as the country begin to normalize, as things begin to open up. Because what we do not see, and we've talked about just a little bit, but we do not see, is the impact on the mental health needs of individuals, of Black immigrants who have, experiences of trauma in the background, and I had to deal with this trauma, and we're not talking about it. We're looking at all of the physical needs, but the mental health needs is going to go many months. It's going to stay with us for a very long time. And we are afraid that we do not have the resources in our community to support our people. Recovery is, for me, is the infusion of funds in the community to address those mental health needs and support our people.
I totally agree with that. I agree with the money coming directly to communities.
Yes.
So thank you, everybody. I appreciate all of you joining us. I appreciate the panels and this discussion. We've covered a lot of topics. And I just want to close with one question of the panelists. You keep it short and sweet. There's been a lot of several questions from participants that really focused on sort of advocacy, action steps. What's our next step? One person even suggested, can we organize an entire Black diaspora in the field of human resources conference, right? So I want to end with you all answering this one question. I hope to get each one of you all's ideas. Please give us one action step, do you think, that we can all do to improve the life of Black immigrants, especially in this moment of COVID-19. One action step or one advocacy that we can do, and collectively, we have several people out there doing the same work, and hopefully, it moves the needle a little bit. One action step. Marie, we'll start with you. Give us one action step that people can do.
Je pense que on doit continuer avec les informations, éduquer la communauté beaucoup plus sur la vaccination, ce que c'est, parce que la communauté a beaucoup d'hésitation contre le COVID vaccine, plus précisément. Ce que je peux ajouter pour finir, c'est que le pays qui est réouvert, je pense que moi-même, j'ai un peu peur, parce que la communauté haïtienne ne se fait pas vraiment vacciner. C'est-à-dire, on est still à risque du COVID vaccine. Je pense qu'on doit avoir beaucoup plus de ressources pour continuer à promouvoir la vaccination. Inza.
Yeah, I believe, I'm going to translate a little bit for her. She says she believes that educating the community, we need to advocate for to educate the community more towards the vaccine uptake. And she believes that the Haitian community are not getting vaccinated because of the information they are getting about the vaccine. Well, what I can say, the advocacy I can ask is, I'm not sure if this is a possibility, but let immigrant and migration itself be part of the COVID recovery discussion at any level. Whenever there's a COVID-19 discussion, let be somebody on the table that say, okay, immigrant and migration, what are we doing about that?
Thank you.
And maybe that will probably bring in the other discussion.
Thank you. Day, I'm going to have you go next, and Ms. Portia will give us the last word.
I will go quickly, and Ms. Portia actually brought up what I was going to say was having conversations around the mental health effects of COVID is really important. We tend not to talk about things that are difficult, tend to ignore and push it under the table or keep it in the house. I think talking to professionals and really trying to get African or Black immigrants aware of mental health is going to be pivotal to us recovering from this.
And Ms. Portia, you have the last word.
Yeah. One action step for me is really, as immigrant-led organizations, is to seek out relationship building with our legislative stakeholders and really working towards making them accountable. for what is happening within the districts and within the communities, and getting them to see the need to support the work that Black immigrant-led organizations are doing on the ground. The need for funding, the need for capacity building. And this is where advocates come in. Without that, we are always going to be the undiscussables until we become the discussables when bad things happen.
Thank you. Again, thank you, everybody. Thank you to the panelists. Thank you to our participants. Thank you to our sponsors, COVID-19 Prevention Network, the Multicultural AIDS Coalition, and United We Rise. I've truly enjoyed this conversation. Everybody, please look out for an email afterwards where you will get a recording of this session and also an evaluation. Everybody be safe and stay well. Have a great rest of the day.
You too, and thank you for inviting us.
Thank you. Bye.
Thank you.
Thank you.